Hi everyone, I'm Dale. The infectious agent I'll be talking about today is hepatitis B. This is an overview of what we'll be talking about today. Just want to go over some background of what hepatitis is. It is the inflammation of the liver. There are many factors that can cause this, which include alcohol, drugs, viruses, and a buildup of fat in our liver. We may have heard of hepatitis A, B, or C, which are the most common ones in the United States, but there are also hepatitis D and E, which are less common here. But today, we're going to focus on hepatitis B. So this spreads, it's a viral infection that spreads primarily through contact with the blood, semen, or other bodily fluids of an infected person. And the virus can cause both acute and chronic forms of liver disease. The virus can survive outside the body and remain infectious for at least 7 days. And the incubation period averages around 90 days after exposure. For symptoms, in many cases, the body can clear the virus on its own. When symptoms of acute hepatitis B happen, they typically last for several weeks, but can also persist for up to 7 months. So they include fever, fatigue, jaundice, which is the yellowing of the eye or skin, loss of appetite, and abdominal pain. And for chronic infection, this can lead to liver cirrhosis, which is scarring of the liver, or liver cancer. So what makes someone at risk for hepatitis B? This virus actually is most frequently passed from mother to child during childbirth and early childhood. But others who are at risk include unvaccinated people, healthcare workers such as ourselves, household contacts of infected individuals, frequent travelers to high risk areas, individuals with certain medical conditions. Healthcare workers are at risk due to potential exposure to infected blood or bodily fluids. So, how can we prevent contracting or spreading hepatitis B? This is preventable with a vaccine. Other ways to prevent the spread of the virus include avoiding sharing needles or any equipment used for drug injection, piercing, or tattooing, practicing safe sex and reducing the number of sexual partners, washing your hand thoroughly with soap and water after being in contact with bodily fluids, blood, or contaminated surfaces. And again, if you work in healthcare, get the hepatitis B vaccine. How do we treat hepatitis B? Most acute hepatitis B, they don't have specific treatment, but for chronic treatment, they can be treated through medication or a liver transplant. And people who start hepatitis B, treatment must actually continue it for life. So for screening and testing, this is done through a blood test. Infants, adults, and pregnant people should be screened according to the CDC. And we can get tested or screened for hepatitis B at your primary care provider's office, here at our health department, a community health clinic, or at your local Planned Parenthood center. And we should care about hepatitis B because it is a major global health issue. 296 million people worldwide are affected annually, according to the World Health Organization. And 1.5 million new cases of chronic hepatitis B infection also occurs annually. So it's an estimated 820,000 people that have died in 2019 because of hepatitis B, primarily because of liver cancer or cirrhosis. So this is a lot of people that this virus is infecting, and that's why we should care. Open to questions. Thank you.